Welcome to Health Matters, a show about what matters in your health here in Worcester and in central Massachusetts. Our show is a collaboration between the Worcester District Medical Society and WCCA TV, channel 194 on your cable TV dial. Thank you very much for joining us. My name is Jay Broadhurst. I'm a family doctor here in Worcester. And for this show, we're going to be talking about vaping. And I'm very happy to be joined by my friend and colleague, Tina Grosowsky. She is the project coordinator of the Central Mass Tobacco-Free Community Partnership and also an instructor at the UMass Medical School. And Tina, you've been working in the substance use disorder prevention business for over 20 years. I'm going to start real quick by just saying, as a family doctor, primary care physician, I've been struck, as I think many people have, about the news recent regarding a person who appears to have died as a result of vaping. And that has rekindled interest in the health effects of vaping. What we don't know, we certainly do know that people have been ill enough to be in the hospital. I have learned in my role at the Massachusetts Medical Society that among the groups that are most concerned are high school and junior high school and middle school principals and teachers, because schools and particularly school bathrooms have become essentially smoking or vaping parlors. I think that schools have had a hard time trying to keep up and keep current with their policies. You and I think we're both involved in helping certainly schools in the central Massachusetts area develop strong, responsible policies regarding cigarette smoking. And now along comes vaping, and so much needed to be adjusted and changed. And I wonder, vaping has been part of the landscape now for 5 years or so. What's your impression of kind of where we are and perhaps where we need to be around vaping?
Yeah, well, thank you for having me.
Pleasure.
We've had many conversations along the way around the development of this epidemic, really. The Surgeon General declared it an epidemic this year, and many communities have been struggling with how to put policy into place, how to provide education for parents and school professionals to respond to this epidemic. And now, as you said in the news just in the past couple of days, there's been reportage of people actually young people going to the hospitals and emergency rooms because of unknown substances in the products that we don't know exactly what's in them. So it's sort of a Wild West out there still, even with the regulations that have been put into place. The FDA is trying to look at some regulations and policies, and they haven't gotten there yet, but hopefully they will soon.
Right. So the FDA is the Food and Drug Administration, and I know as a physician, when I write a prescription, I can rely on the testing that the Food and Drug Administration has required that help me know, from an evidence perspective, how safe a medication is, how effective it is, what the dosage should be, what the dosage range is, what the adverse reactions are. And I guess the vaping product is not something that is currently regulated by the Food and Drug Administration.
Well,
is that right, or not?
I think more accurately to say that it is regulated, but it's not regulated in terms of what is in the product. It's regulated by age. It's regulated by sales.
Oh, I see. So you cannot sell to someone who is younger than an age.
Right.
But the manufacturing, the competition in the marketplace, typically, traditionally in the United States, if I make a product, I want to put whatever I think is going to make it the best and have it sell the best. And I don't share that information with anybody else because it's a trade secret.
Right.
And so we have different companies. The one thing that we know that seems to be in all of these vaping products is nicotine. Is that
Right.
right?
They all contain nicotine.
Right. And so nicotine is that addictive substance,
Right.
which is also in the tobacco leaf and winds up in cigarette smoking, which
Right.
is the primary culprit in the addiction to cigarettes. And presumably inside the body, the nicotine receptors don't care if the nicotine came from a cigarette or came from a vaping liquid solution. They're still going to get stimulated and they're still going to get hooked. Is
Right.
that
Right.
right?
And especially some of the more popular products like the Juul, which is a brand name that's been very much in the news these days, both from the FDA, who did try to put some pressure on them to remove some of those attractive flavors that young people like so much in the stores, but also because each flavor pod that the brand has of Juul is equivalent to a pack of cigarettes in terms of the nicotine content. So for an adolescent, we know that it's much more easy to get addicted as an adolescent. The brain's much more susceptible to the addiction. And for young people to go through a pod a day or perhaps even more if they share it with other people, and then go through another, what they call a flavor pod, which is the little device that has the product of the nicotine in it.
That's the liquid insert that goes into the vaping appliance, and then the appliance makes that into a vapor, which you then inhale.
Right, because
But
it
one of
heats
those
it up.
pods is
Equivalent.
to a pack of cigarettes in terms of nicotine content.
That's right. So
Well,
that's a lot of nicotine.
So you've mentioned flavors, and I want to focus on that a bit because I believe I'm right, and I maybe didn't pay as close attention in medical school as I should, but I believe that nicotine either doesn't have an attractive flavor or in fact it may have a bit of a unpleasant flavor. I'm not sure, but I don't think anybody is interested in nicotine. So in order to make it palatable, you dress it up. You combine it with other things. And
Right.
so what have the vaping manufacturers done to try to encourage people to buy their product with flavors?
So again, the Juul company did two things. They made a device that mimicked the rush to the brain of nicotine above regular combustible cigarettes, so that compared to regular e-cigarettes, it was very slow to get the nicotine to the brain. So smokers were not very satisfied.
Oh.
So the Juul, because of how it's technologically made, delivers a hit to the brain really quickly of nicotine, and is very satisfying. So it's a big rush to the brain. Then there's the flavors that they put in, which is not orange juice or mango juice from Market Basket. These are chemicals.
Yeah.
It's a chemical called diacetyl, which has been shown when heated. Again, the problem is when you heat up these products, and chemicals has been shown to cause lung infections and respiratory problems, and maybe even precursor to cancer. So when you combine the heated diacetyl and the heated propylene glycol, which is what the nicotine is in, then that's when it creates respiratory problems. And
So those are irritants,
yes,
I guess, to the respiratory tree.
that's right. That's right. So for young people, the addition of these flavors is very attractive, and the Juul company was very savvy at first to market these products with these flavors in them.
Well,
Now-
my recollection was that, I mean, we're talking about flavors like bubble gum or
Cherry, grape.
cherry, fruit, exactly.
Right.
Things that a child would be attracted to.
Right. So not flavors that an average adult would
Right.
look to use these products. So, the good news is that FDA did come in after this epidemic was announced and said, to the Jewel Company, we'd like you to see you remove those fruit flavors from the shelf.
Mm-hmm.
The problem is that what was remaining is the flavor that's called menthol or mint or wintergreen.
Oh, okay.
Because
so menthol, mint, and wintergreen are the things that are still there on the shelves.
That's right.
I see.
Because, as you probably maybe know, the industry has allowed, and again, the Food and Drug Administration has allowed menthol to become a protected flavor. So that in 2009, the industry wanted to make flavored cigarettes. The government said, no, you can't make flavored cigarettes, but they said, and the industry said, well, can we keep menthol as a flavor? And the public health community said no, but the government went ahead and said, okay.
So menthol was the first protected flavor.
Right. So when many communities in Massachusetts, now over 150, have passed what's called the flavor restriction, which is a public health strategy to reduce the access to these products for young people, in many communities successfully passed these regulations. But the problem is it has left the mint jewel flavor in the convenience stores, the gas stations, which is the most popular flavor for young people.
The mint is, I see.
The most popular.
Now, what about in Worcester in particular or central Massachusetts? Are there communities that have these flavor restrictions?
There's many communities that have the flavor restriction. Worcester is included is one of them, but all of them have not included mint or menthol in them yet. So some of them, for instance, the town of Shrewsbury just had a public hearing a couple weeks ago, and they'll be looking at their regulation and deciding whether or not to include mint, menthol, and wintergreen in their flavor restriction. So they'll be one of the first if they do include it. So that would be important because it would get all electronic cigarettes with all the flavors out of the convenience store market for young people.
So it makes me wonder what the industry will do to try to replace these flavors, because it sounds as if they have been a fairly successful part of the marketing and the interest in people actually buying these products and using them.
Right. Well, there's always a new product around the corner. So a new product that has just been developed and is being used in Europe is called heat not burn. Heat not burn products.
Okay.
And there's an acronym for one of the brands, IQOS, which stands for I Quit Ordinary Smoking. So this device looks like a cigarette. When you turn on the battery, it heats up the tobacco. There's actually tobacco in them as opposed to electronic, which is just the chemicals.
Which are those pod chemicals.
Right.
Yep.
In the heat not burn, the nicotine leaves are, and the tobacco leaves are heated up just to the point that it releases the nicotine, but there's nothing burning or combustible.
I see.
So those products are new coming on. The FDA's already granted permission to the companies for sale for those products, even though they haven't been tested.
Right. And tobacco, in and of itself, does have a flavor, a
That's
distinctive. Right. I remember I went to medical school in Richmond, Virginia, and there were some drying barns that were not too far from the apartment that I had. And I can remember on a warm summer afternoon or evening, it was easy to identify the odor of the drying tobacco leaves, and I think many people find that pleasant and attractive.
Right, and you can buy tobacco flavored pods. That is a flavor.
Oh, I see. So tobacco is a flavor.
It's a flavor.
Along with mint and wintergreen and menthol. I see.
Right. So they've been savvy and they've put that into the electronic devices. Yeah.
So let me just take a quick moment to say to our audience, you're listening to Health Matters, a show about what matters in your health here in central Massachusetts and Worcester. This particular show is about vaping. My name is Jay Broadhurst, and I'm joined by Tina Grosowsky, who is an expert in caring for individuals with substance use disorders generally, but also a particular interest in tobacco and tobacco cessation and helping people not only stop, but also being mindful about trying to prevent people from starting.
Right.
So where do you see this going? I'm concerned when I hear about, individual municipalities having to pass these regulations. Is there any possibility that there might be a state action on this in Massachusetts, or is that not something that's
Yes.
happening?
Yeah, that's exciting that you asked the question because, as you know, the state did pass through the legislature raising the age to 21 this year in January, which they voted on last July. So you have to be 21 now to purchase tobacco products in Massachusetts.
And does that include vaping products or no?
Includes vaping products, all tobacco products.
Oh, okay.
Yep, and you can't buy any tobacco products in a pharmacy. So that's another state law that was passed last July, went into effect in January. So similarly to passing the flavor restriction, those two statewide bills were passed at the local level, town by town, until enough towns passed them that the legislature was willing to take it up as a statewide bill and pass it. So similarly, now the flavor restriction has been passed by over 150 communities. So the legislators individually have filed bills to put forward a flavor restriction. It's being now passed through committees. That's the legislative process, how a bill becomes a law.
Right, exactly.
And so hopefully it will become a law, and it will include menthol and wintergreen.
Well, that's, I was just wondering whether it included those, because it sounds like there's been some confusion or some willingness to allow those to continue. But as you pointed out, mint is the flavor of choice for children.
So that would, again, on a statewide basis, eliminate the sale of those products in convenience stores and gas stations for young people. It would, however, still leave menthol cigarettes in the marketplace. And that would be the next step of looking at, who uses those products, what populations of people are targeted by the tobacco industry using menthol products, because they do target specific populations, minority populations, LGBTQ populations, and helping to educate the communities about that, and then let the communities decide what next steps they'd like to take, which is really important. So the next steps on a statewide level seem hopeful, and we're hoping that with advocacy from the medical community, from public health community, from the now especially the educational community, because they've seen the ramifications of having these products available to young people.
Well, that I had said in the first part of the show that I had heard that the principals and the teachers were alarmed, and I wonder, from your perspective, are there strategies to try to help kids not start with either vaping or cigarettes?
For sure, that's a really important part of any health education that a high school will do. Now there's new curriculum that's been developed. It's called Catch My Breath, that is specifically aimed at education around vaping for middle school and high school students, and even elementary school, because some middle schools start 5th and 6th grade these days, and those young children really need to know the facts about these products, so that if an older friend offers it, they know how to practice refusal skills, so that they know what to say, and understand the ramifications of use of them, and develop conversations with their parents. So we need to educate parents about how to talk to their children about these products, and to be able to allow them to ask the questions that are really important to find out about them.
This is putting you on the spot a little bit, but I wonder if you have some tips that you might share with our listeners who are parents. What are the kinds of things that a parent needs to try to do to help that 12-year-old, 13-year-old, 14-year-old not get started?
Yeah, well, and grandparents too, because now there's so many grandparents that are raising,
who are providing direct parenting to their grandchildren. Sure.
Yes, I'm sure that you've probably even seen that in your practice.
Yep, absolutely.
I think one of the most important things is first for the parents to educate themselves about these products. I spent this past year giving many, many presentations to parents and to school professionals. And parents are always surprised at what the products look like, how easily they can be hidden,
Yes.
how easy it is to purchase them, and again, all the flavors that they're available in. So that's the first thing that parents and grandparents should do.
Yep.
And of course, if anybody's interested, they can get in touch with me through your organization or through the links that are provided, I'm sure, through the TV,
Right.
on the television.
Right.
And someone can always reach me at the UMass Medical School through my office phone number, which is 508-856-5067.
So 508-856-5067.
Right.
Okay, got it.
So that's the first step, is education. The second step is for parents to talk to their schools and where their children are going to school and make sure that they're providing the right education for their children. And then the third would be to have direct conversations with children about the products themselves. They may do it while the child is in the back seat of the car. That's often an easy way to have a conversation with young children about risky behavior because you're not looking at them directly. And you can say, "Oh, look, there's the King Vaping Shop," or or
there's a billboard. Actually, I don't know if there are. Those may be illegal to have billboards, but you're right. There can be or you see somebody on the street, and you can use that as a way of starting a conversation.
Right. And you can say, "Have you heard about these products?" Or, "Have any of your friends, do you see any of your friends using these products?" And usually that will open the door to a young child saying what they know about them. And then it's important for the adult to not to provide education in a nice way, gentle way, and not provide criticism or judgment of the products if they think their child has been using them, but to provide the facts. And did they know what they have in them, which is the nicotine?
Right.
Many young kids think that these are just flavored devices. They do not have any nicotine in them.
Right.
So that's the first order of education, is to provide the information about nicotine. The second is the heated other chemicals that are in them.
Right.
And the third is we don't know the dangers because they haven't been around long enough.
Right.
Right?
Right. And the other thing that I think is a little bit unusual, certainly with traditional cigarettes, there's a risk of fire, and we know about fires that have been started because of a discarded cigarette or whatnot. But these devices seem to be, at least, sometimes the batteries will overheat. They can start fires. They exploded in people's trouser pockets, a variety of things that just have to do with the device itself.
That's right. It's not safe.
Right.
It's not safe. And of course, I'm sure that you get asked this many times about what is the least harmful. Is smoking less harmful or vaping less harmful? And we say that vaping is less harmful than smoking, but it's not harmless.
Yes.
Because
absolutely.
of the heated products, and again, because of the safety issue of the device, too.
Yeah. I share with you that concern that, in this competitive business where companies are trying to sell a product, the actual contents, those chemicals that are going into that pod, we don't know really. We also don't know from a medical perspective how they are affected by being heated up by the element. What we do know is that those molecules are going straight into the lungs and straight into that, very fine blood lung barrier, and they're crossing into the blood right away.
Right.
And it's bypassing the liver, so there's the body is not getting any protection at all from these things. Now, there are teens who will, in fact, start and become hooked. They will have nicotine dependence. What kinds of resources are available to try to help those individuals with quitting?
Yeah, now we're lucky because the state connection to the National Jewish hotline, which we've used for many years in Massachusetts for the quit line for helping smokers to quit, has
Right.
now come up with a hotline called My Life, My Quit, which is for teenagers specifically. You can go to the website, My Life, My Quit, find the phone number and call in, or you can find the texting and text into the My Life, My Quit and get a live trained tobacco treatment specialist, the same as you do when you call into the smokers helpline,
Right.
to talk to. Now, we know that many young people are not interested in talking to adults on the telephone, especially about their personal issues or feelings or health problems. So the first step would maybe be getting them involved through texting, because we know
Right.
they're on their phones all the time.
Exactly.
They're very comfortable with texting. So texting trained tobacco treatment specialists to get help with recognizing the symptoms and the signs for nicotine addiction, and then what are some of the first steps to wean yourself off the device.
Right.
We know that for pediatricians and family medicine doctors like yourself, providing motivational interviewing with young patients is really important. We know that many young people who are addicted to these nicotine products are basically high achieving,
Yep.
academically oriented young people who participate in sports and who often complain now because they're having a hard time breathing on the soccer field, and they're having a hard time breathing on the, the lacrosse field.
Yep.
And so providing some motivational interviewing for them. What do they really want to do this, in this semester? What goals do they have and how to reach them? And what can you do to help provide them with that kind of motivation to get
And so
off the device?
This website, mylifemyquit.com, is particularly geared for the teenager. They'll engage on different platforms. It's not just the telephone, it's texting.
Right.
So we've covered a lot of ground during this show, and I just am delighted that you've been able to come on to give us an update. It's a tough time now with this vaping issue. We're running into now more concerning medical problems, and I think it's important for our listeners to be up to date. So thank you for joining us on this edition of Health Matters. My name is Jay Broadhurst. I've been joined by Tina Grosowsky. I'd like to thank Frank Rocco, our engineer, for all his help in putting this show together, and I hope you'll join us next time on Health Matters.